So diastasis recti, and I'm probably saying that wrong, so I call it just DR or ab separation, is the gap between the abdominis rectus, which is AKA your six pack. So during pregnancy, the linea alba, it's the connective tissue that is literally in the middle of your six pack. It goes from the sternum to the pelvic bone. What happens during pregnancy is that it softens and it relaxes. So as the connective tissue or your linea alba widens, the rectus dominus, aka your six pack muscle, so that left side and that right side, move apart to allow that abdominal wall to expand as the pregnancy develops. So essentially it's making room for your baby. So that ab separation is completely natural and completely normal in pregnancy. Like I said, it's allowing that baby to grow inside you. So almost 100% of women will experience some type of ab separation in their pregnancy, especially in that third trimester. Because like I said, it's allowing your body to make room for that baby. So postpartum, there are some women that do have their ab separation healed naturally without any intervention. However, there has been a study that 1 in 3 women, so a third of women, still have a mild ab separation a year postpartum. So how do you know if you have it? So ultrasound imaging is gonna be that gold standard for accurate measuring. However, there is a test that you can do at home. It's called the finger width test, and I'll demonstrate that in a second and explain that a little bit more. But depending on severity of your ab separation, so how many fingers in between the abdomen walls, I strongly suggest seeing a physical therapist. Although there are exercises that you can do to begin healing that ab separation and that linea alba, again, depending on that severity, I strongly suggest seeing a professional. So to figure out if you have ab separation, we're gonna do the finger width measurement. So what you're gonna do is you're gonna lean back, your knees are gonna be bent. Essentially what you're gonna try to see is if there's a gap above your belly button as well as below your belly button. So not only are we looking for the gap, we're also trying to see if your linea alba is squishy or if there's tension. So what you're gonna do is you're gonna go ahead, grab your fingers, go into a crunch position, so lifting those shoulder blades off the ground, and feel above your belly button as well as below your belly button. So depending on how many fingers are in that gap is going to determine essentially the severity of your ab separation. So figuring out the severity of your ab separation, if it is 2 to 3 fingers, it's gonna be mild. 3 to 4 is gonna be moderate, and anything 4 or more is gonna be severe. So especially in those cases, again, I strongly suggest you going to a physical therapist. Like I said, there are exercises to help with the healing process, and I'll go over those in a later time, but I strongly suggest working on that deep core breathing.